Doctors/nurses. What was the most, how the F are you not dead patient? Story 1. His safety gear failed, and this guy fell 128 feet from a communications tower. It had rained the night before, and he fell into a marshy puddle of high grass, flat on his back, concussion and whiplash. No broken bones, but the bruises that covered his body from head to heel were something to behold. He spent a week in the hospital before he could move comfortably. Story 2. As a lab tech, I had one I dubbed Everything Guy. He was complaining of a sore stomach after coming home from overseas, so got the usual "what were you doing?" questions. He was in West Africa. Didn't bother to get anti-malarials. No vaccines. Admitted to eating bushmeat. Also said he thought it was undercooked. Drank water from a local source. Turns out this was directly from a river. Without filtering it. River was apparently badly polluted. Hired prostitutes while there. Didn't use protection. He basically saw everything you shouldn't do on holiday and used it as a checklist. Story 3. A friend of mine was feeling crappy for days. He'd go to work, feel exhausted, come home, sleep 13 hours, repeat. Finally he got to feeling so bad, he decided to go to the ER. He drove himself, around 3 a.m. He got out of the car and the security guard said, "Oh my God," and ran to get him a wheelchair. ER admissions said, "Oh my God," and got the ER doc. ER doc noted my friend was quite yellow. They ordered blood work. When it came back, the ER doc didn't believe it and had it done again. When the second round came back, the doc asked my friend for next of kin information. My friend said, "You can't call my mom, it's 4 a.m., and the doc said, "Your kidneys have completely failed. We're going to send you upstairs and give you a pint of blood and an hour of dialysis, and we need to know who to call if you still don't make it. You should have been dead a month ago." He got a kidney from his sister and is still doing well today. Apparently the kidney was as close a match as one can get, and he should live an essentially normal lifespan. Story 4. I'm not a doctor or nurse, but the doctor who saw my mom said he had no idea how she was alive. Years ago, my mom was having gastrointestinal problems. She had incessant stomach aches and was bound up something awful. After 3 days of not being able to poop, she went to the doctor to get checked out. After a thorough examination, the doctor determined that her gallbladder needed to be removed immediately. The next day, after the surgery, my mom comes to and sees the doctor standing over. And he wasn't happy. "Your gallbladder was dead," he said. "Like dead. In fact, it was completely gangrenous. Had you waited another day to see me, you would have died. Had it ruptured during surgery, you would have died. That was the worst, most stress-inducing surgery I ever had to perform in my 20-year career. No offense, but I hope I never see you again." And he walked out of the room. Story 5. Had a patient with an internal temp of 75 F. He was drowsy, but fully alert and oriented. He was found in a river embankment in the middle of winter. He had been lying there overnight before he was found by a dog walker. We didn't believe the equipment when it told us 75 degrees, so we repeated with a rectal thermometer, then a different rectal thermometer, and then a rectal probe attached to the bedside and Meditherm system. They were all consistent, and after several hours of heating measures, we got their internal temp up to 90 degrees before they went to ICU. The second, how the F are you not dead patient was a person who had a blood sugar of 1,800. They weren't in a coma. Just a woman who walked in to complain about abdominal pain. Story 6. During my EM rotation, guy had a road accident, flesh wounds as deep as his intestines were out. Around 40% of his face was scrapped off. One eye was out of the socket. The right forearm had ripped off muscles and you could see the bone. Now the miracle is that the bleeding somehow had stopped, and when I came in, I saw his chest moving and him holding his intestines. I was like, yeah, wow, this guy is alive. We helped him, stitched everything back, the face was reconstructed, and now he is alive and well. Story 7. I had a patient I just delivered. We pushed for 4+ hours before ending up in a C-section. We get back to the room, and I push down on her belly to check the bleeding. It was a little excessive, so I call the doc. He came in minimal bleeding, because that's how it goes. The blood pressure goes off, it's in the 60s. I do another fundal, and had just non-stop tennis ball size clots coming out. Luckily the doc was at the nurse's station, and someone showed him the blood pressure. He comes into the room as I'm doing the fundal, and immediately calls a massive transfusion protocol. We end up in the ER giving her so much blood, he placed a tamponade balloon, and we go to PACU to finish the recovery. It's just me and one other nurse. Everything is going well for a bit, But then there's more bleeding than normal in the drainage bag. Her lips are blue, face is super white, and the blood pressure red in the 50s. The doc sends his resident to check it out, who says it's fine, and to give more blood. I ended up calling the anesthesiologist and asking him to come assess. He was known for being rude, but he came in there and immediately called the OB and yelled at him to get in there immediately. I had a lot of respect for him after that, and was really grateful he hadn't blown me off. I still don't know why he didn't blow me off when I called him. We end up back in and she ends up needing an emergency hysterectomy. The doc described her uterus as being a paper bag. I came from ICU step-down and was used to patients that looked like crap, but I really thought this lady was going to code and die. It ended up she lost like 3 liters of blood, was intubated, and in ICU for a few days. I never went to go see her again because I was so mortified by what had happened. I was newer to labor at the time and kept feeling like I made a mistake somewhere. Story 8. 18 years ago, I went into the ER to get a cyst lanced open. 3 weeks later I felt pain in my back. I went back to the ER and they found nothing. Only did x-rays. I felt weak leaving, so went home and crashed on my couch. I woke hours later and tried to get up and fell. I went down fast. I called an ambulance and went to the hospital. I sat for 6 hours until finally someone came to check me out. I had a 105.0 fever. They immediately rushed me into a MRI and low, and behold, I have MRSA inside my spine. I was rushed into surgery and now live from a wheelchair. T5 to T11 I'm fused. The doctors said if I waited one more day I wouldn't be here. I did 16 weeks of vancomycin through 3 hours twice a day. I'm truly lucky to be alive today. Story 9. My ex-boyfriend is a ski instructor. He told me that one day, all the slopes were extremely icy and many people were coming in with injuries. He had fallen badly and returned to the ski lodge. He was checked out and said he felt fine. Fortunately, a paramedic happened to be looking at him when his helmet swung open on the side because it was very badly cracked. They took a 9-year-old girl with a broken femur off a stretcher and put him on it and took him to the hospital immediately, where they found he had broken his neck and needed immediate surgery. Amazingly, he is mostly fine, except for now having acid reflux for some reason. Story 10. The CPR algorithm changed about a decade ago from ABC, airway, breathing and circulation, to CAB, circulation, airway, breathing. This means that instead of opening the airway / giving rescue breaths first, we began doing compressions first. The first time I used the new version was at a witnessed arrest. I happened to be at the bedside when the rhythm changed and was therefore able to start treatment immediately. The patient became unresponsive, pulseless, and the rhythm showed ventricular tachycardia. I began chest compressions and the patient raised their arms and tried to fight me. Confused, I paused and checked a rhythm / pulses / assessed their alertness. The rhythm was indeed pulseless ventricular tachycardia, and they immediately rolled their eyes back and went limp. I must have gotten on the chest so quickly that they hadn't had time to lose brain perfusion. It's never happened since. Story 11. I used to work in obstetrics and the preemie ward. I've seen some extremely premature babies that looked like they were barely hanging on. Tiny head maybe 2 inches from chin to top of the cranium, purplish / reddish translucent skin that looks paper thin, eyes closed, not responsive, limbs smaller than a finger, and always extremely skinny. They often face lifelong problems due to being born so premature. I remember once asking the doctor why we even bother at that stage, since it looks so hopeless, and in some cases is frankly. She said, and I remember very well, the preemies that were hopeless cases 20 years ago now live normal lives, so that is why we keep on pushing. Story 12. Case 2, my best case ever. A young woman in her 30s had a stroke. She clotted off the basilar artery, the big artery in the base of the brain that supplies all of the primitive functions like breathing and awareness. I found out about her a day after the event. This, by the book, is a hopeless case. She was literally already dead. But because she was young, they prevailed upon me to do something. I poked a catheter, a long skinny plastic tube, into her groin artery, then snaked it up to the blocked artery in the base of her brain. I infused a clot-busting drug into the artery for about 12 hours TPA. I rechecked, and the clot was gone. She woke up the next day. After a month, she literally walked out of the hospital. She sent me a nice card a month or so later. It bothered me that her handwriting was better than mine, even after her stroke, but I was pretty happy. Story 13. I had a hemorrhage I didn't know about. I had seen some blood while wiping that was a bit more than I chalked up to wiping too hard. Went to a physician and he checked my anus and told me I had hemorrhoids that I had probably agitated. Recommended I use baby wipes and preparation H. Well, 2 days later, I had started feeling very nauseous with a nasty headache. I slept right up until it was time to go to work, and so decided I shouldn't call off. About 5 hours into my shift, I go to take my break and use the restroom. The moment I pushed, I passed out and fell off the toilet, to be found by my co-worker however much later. EMTs are loading me up and start taking my vitals. My O2 levels are low AF, and when we got to the hospital, they rushed me through the back and into a room. They say I need blood pronto, and I remember passing out again. The next thing I woke up to was an RN throwing my curtain open and shouting, "Why the F isn't he hooked up yet?" Apparently the ball was dropped somewhere between getting my blood type and the blood dropped off. So I sat there for over 45 minutes needing blood, and that RN was madder than hell. Finally get hooked up, and I took 3 pints of blood, stayed overnight, and needed another pint by the next afternoon. Hemorrhage was found, microsurgery performed, and I've been fine ever since. The same RN came to see me after my surgery, and told me she was terrified I was going to die when the EMTs handed over my vitals when dropped off. Story 14. Not me, but my mom was an ER nurse right after college. A family got in a car crash, and there weren't any serious injuries. They were just taken to the ER to be assessed. They had a baby, and my mom was asking them questions about its health, etc. When she asked what the baby was being fed, the mom said juice. Just juice. She had heard that at 6 months, you can start feeding the baby juice. Not realizing it was juice, in addition to baby food or milk. This woman had been feeding her baby only juice for months. People have a lot of questions from this post, and I don't really have any answers other than this was something someone said to my mom in the mid-90s, probably in Cleveland, Ohio, and I have no other info. It was almost 30 years ago, and I have zero idea of what happened to those people. Story 15. Not a nurse, but this is a cool story. My dad has a blood condition that makes him prone to clotting, and it has sent him to hospitals several times now. The most recent case was this. He had started doing nightly runs, raising money for a charity, and every time he came home, he'd be more and more puffed out with a really sore leg. He mostly just thought it was muscle cramping until at one point my mom just told him to check it out in the doctor. Doctor almost immediately told him to go to hospital as soon as he described it. Hospital took him in, sent him for an MRI, I think. And in the nurse's words, they stated it was the largest blood clot they ever saw in a person that was still breathing. So that was a fun week. Story 16. I'm not a nurse, but I did work as a stock tech in the critical care or at the hospital I work at for a while a few years back. I heard the call come in, and all of the staff rushed to prepare a room for an incoming patient. When they came in off of the elevator to the life flight landing pad, I saw this kid, probably 16-ish, get wheeled in with paramedics completely surrounding his head in particular. I figured he just had some sort of severe laceration they were trying to keep from bleeding, as there was a lot of blood. They took him into a room, and I followed with a feeder cart. That's when I saw his head, or more accurately, what little was left of it. Basically the entire front half of his head was completely missing. Eyes, nose, jaw, tongue, forehead, everything. The nurses around his head were desperately trying to hold his brain in while he was intubated. Apparently he had attempted suicide via shotgun to the chin. The worst part was he was still alive. He was groaning, gargling, wiggling his hands and feet, and it seemed he was still very much aware of what was going on. I had to move on to other areas of the unit, so I'm not 100% sure what happened after that, but I seriously doubt he survived much longer after that. I can't even imagine what that must have felt like. Poor kid. Story 17. Back in my surgical days, resident on my trauma rotation. Really nice young guy comes in via EMS. He'd been working on a factory site doing work high up on a tower, think 80 to 100 foot kind of deal. Was climbing his way down, about halfway, when he hears commotion overhead and someone shouting, "Watch out." He's on the ladder, so can't do too much but bows his head to cover it. Feels something strike the back of his neck. Manages to stay calm, reaches around and realizes a large piece of metal is embedded in him. His medic training kicks in. He calmly climbs down the rest of the ladder, sits down and asks someone to call an ambulance. Wish I could upload the photos I have. It's a wrench 36 centimeters / 14 inches long, but the non-wrench end is a pointed pickaxe type tool. And that's what's embedded in him. Nestled nicely against C3/C4, middle of the neck. All we can get is X-rays, too much metal artifact for a decent CT. Can't see any fractures, fully intact neuro exam. Rock star of a spinal surgeon just decides to yeet it out. Few stitches, soft collar for a week, and guy's back to normal. Story 18. Dealt with something similar years ago. Gangrene from diabetic complications on a woman. She had already had one leg amputated for the same issue, and was then apparently considered too high risk for a second amputation. It was a death sentence for her. I remember other co-workers making morbid jokes about when her toes would fall off and which one. The worst part was towards the end she wasn't really with it anymore. Totally liquid diet and liquid meds. I think liquid oxy just as needed, and those cheek swabs to keep her hydrated-ish. Her family came to visit, and you could see she wasn't really responsive anymore, so they just settle in and start bitching about how bad she reeks. Like, I can't imagine those being my final moments, my family members showing up to sit around and complain about me dying with too much odor as my body rots around me. Holy shit, was it the worst smell I've ever dealt with? Yes. Did I feel the need to non-stop whine about it? No, it wouldn't have changed anything for the better. It would have cost those people absolutely nothing to have stayed quiet, and yet they still chose to be like that. Story 19. Not a nurse or doc, but had a doctor say this exact thing to me. 18 just received delivery on a new motorcycle, rolled out of the dealership. A B-double driver had fallen asleep and drove through the highway barrier into the service road, which I was on, and then into me. I saw it coming and braced, somehow survived. About a month later, I took delivery on my second road motorcycle to promptly get rear-ended at a red light, but a drunk driver. Then at the end of the year, I got into an abseiling accident where a poorly anchored sling had dislodged and added additional rope to the line and jarred my back. Got the hospital, same doctor again. He straight up said, "How the fuck aren't you dead, and why are you back?" Story 20. I work in the public health field, and I've had a few patients to track down that I honestly had no idea how they survived. One had a laundry list of issues: Hep B, C, endocarditis, mitral valve messed up, AIDS, abscesses, disseminated MRSA in their bloodstream. I was required to gown up, mask, gloves, whole 9 yards just to be in the room with them, and I quickly found out they were in no state to answer questions I had. I find out later they were transferred for open heart surgery to a different hospital after, no lie, attempting to check out against medical advice, AMA. At hospital number 2, they have completed surgery, and finally are somewhat on the mend. Their parents checked them out, again AMA, to make the multi-hour drive back home. I was flabbergasted and sure, no way they'll even make it home. And lo and behold, they crop up again in a public health investigation, a year later alive. I was shocked they had survived that long. Story 21. I had extensive osteomyelitis in my foot from an infection the year before. I had done 89 days of outpatient vancomycin for a MRSA, then, and I was in heavy denial that the infection had returned. Due to the dead bone, I had been told when the infection returned, not if. I was sleeping about 20 hours a day and could barely function. Finally, after my wife threatened to divorce me if I didn't act, I went back to the outpatient clinic to go back on 4 meds. I rode there on my motorcycle, in the rain no less, and go through the ER to get back into the outpatient program. The first thing they note is my pulse oximeter readings are 68. They usually start freaking out at anything under 90. Next, my blood pressure crashes to 78/42. I am rushed by ambulance to a major hospital and found to be septic and in early stage organ failure. I vaguely remember an ER nurse who was very nice to me, but it was mostly a blur. 2 weeks later, they amputate my right leg. A couple of days later, a nurse comes to visit me to tell me I was the politest corpse who ever passed through her emergency room, and she was happy to see me on the road to recovery. I will try to answer multiple questions here. Yes, still with my wife, she stood by me throughout my ordeal and recovery. I am indebted for her saving my life, and I thank her daily through my words and actions. My denial came from not wanting to be as sick as I was the year before. I thought I could will it away. The pulse ox and BP stats are correct, not typos. The outpatient clinic told me I had set some kind of an enviable record, not only for being upright and conscious, but also in a rain suit having arrived on a motorcycle. Apparently, your body can adapt to these extremes if the downward spiral is gradual. Mine was over about 4 months. If you took an otherwise healthy person and applied those numbers to him all at once, they would pass out or die immediately. The human body's ability to adapt is amazing, but make no mistake, I was a walking corpse. I ended up with a BKA, below knee amputation. I use a prosthetic limb. I walk without aids. My left foot got messed up too, with Charcot foot, and I wear a brace on it daily. But I both drive and ride without vehicle modifications. I own and run a successful business. I go to the doctor regularly, and I listen to my wife. Story 22. Not me. My wife works in radiology. A guy came into the ER and was looking a little pale. He was coughing a bunch as well. Doc sent him stat for a chest x-ray. Note that this guy was mid-40s and appeared in pretty good health. As my wife was scanning him, he started to look a bit more blue in his hands. She kept asking if he was okay, and he assured her he was fine with perfectly normal responses. She was the only person in the room with him at the time. He stopped coughing and seemed all right. The second he was done with his scan, he thanked her for taking care of him, and he was ready to go home. She was looking at the scan with a holy shit face because his lungs were completely clotted up. Of course, as a tech, she can't say shit to the patient. She had that, "How are you alive?" thought. He dropped to the ground and started spitting blood. My wife immediately hit code blue, and emergency staff rushed in before she had to try to administer first aid herself. He was instantly dead. Pulmonary embolisms that just dropped him right there. Story 23. I have a few that stick out in my mind aside from hospice patients who have hung on for a surprisingly long amount of time. First was a patient in third-degree heart block with a pulse of 30 at best. Sitting up and talking like nothing was wrong. I was a new nurse at the time, and that freaked me out. Basically, the electrical system in the heart was malfunctioning, and this person was flirting with a massive cardiac event. Then a lady with a hemoglobin of 4. It should be at minimum 12. She was whiter than the bed sheets. It was really unsettling to see a living human that color. Finally, I had an alcoholic patient. Blood alcohol of 0.4 something, and they were conscious. They drank a handle of whiskey a day. I was concerned, impressed, and surprised at the same time. Story 24. Not a nurse, yet, but I am a nursing student and a nursing assistant at a hospital. We had a patient who came in with a blood clot in her leg from overdosing on heroin, and passing out / overdosing in a position where her leg was pinched beneath her. She was presumably found after almost 2 days, somehow still breathing. The clot in her leg formed while it was pinned awkwardly beneath her. This patient was with us for almost 6 months. Normally patients are there for about a week, give or take a few days. During the 6-month stay, she was losing weight drastically as she refused to eat. Her hair was matted and had to be cut off after many attempts to comb out the matting. She was probably 5 feet 6 inches and was now down to 90 pounds. She refused to participate in her physical therapy almost every day. She just didn't want to get better, but was also very manipulative with the clinical staff, only wanting pain medications but refusing to even have her vitals taken. Physical therapy pushed every day, and some days were successful in getting her out of bed. After she was strong enough to walk with a walker, and the blood clot had been treated, she was discharged to a shelter downtown. Within 24 hours, she went to the ER at another hospital, and they sent her back to us. There she stayed another 8 months, with her same old ways, refusing care and not eating. By the time she finally died, she was 68 pounds and had basically starved herself to death. She refused feeding tubes. Basically, any help the clinicians suggested she denied. I don't think she would have even lived that long if it weren't for the 4 fluids. She was seen by a psychologist many times and would refuse their help as well. She looked like death from the moment she came in. I just couldn't believe she was a resident at our hospital for over a year before she finally passed away. Edited to add a detail I missed. Story 25. Somewhere between 2001 to 2004, we had a patient who had a chronic PSVT, fast heart rhythm, who would eventually go into VT, fast, irregular, unstable heart rhythm that will kill you, and need shock to get back to a functional rhythm. He was basically coding while awake and needed defibrillated, or he would die within a minute or 2. Chemical conversion for heart-stopping / restarting medication didn't work on him for some reason. He required defibrillation. VT is an ineffectual heart rhythm. It is not conducive to life. PSVT and SVT are like their precursors or predictors, so to speak. Your heart can only do PSVT / SVT for so long till it's like SpongeBob and says, "All right, I'm out," with a last little run of VT. Then you dead. Edited to say, death would be from cardiac arrest. Not a heart attack, technically, but cease of function equals arrest. Trying to keep this in layman's terms, but not saying cardiac arrest unintentionally makes the cause of death unclear. Defibrillation hurts. If you are conscious, it is not a good time. We sedate you with benzos like versed before we shock you because of this. This guy was also a drug abuser. He would stop taking the meds that kept his heart rhythm regulated, different than chemical conversion, more like chemical maintenance or prevention from going into the fast rhythm, just so he could come into the ER, where we didn't have time to debate whether we should give him benzos or not. We had to defibrillate him, and soon, or he'd go into VT and be dead. I think the first 3 or 4 times he got versed. After that, the doctors figured out his game and shocked him without it. He played around with his own heart, just to get a buzz, and he did it so many times he really should have been dead. I don't know how exactly he was timing it to be in the ER when he needed to be, or maybe he was just walking around in PSVD all the time, without actually going into VT. But it just seemed like he should have been dead so many times. He did it so much in like the span of a couple months, they ended up putting a pacemaker in him. The oral medications he took slowed his heart rate down effectively, or maintained a regular, effective heart rate/beat once he was defibrillated. A pacemaker wouldn't have been required if he would have just continued taking the medications. But they put a pacemaker in him, so that he couldn't manipulate his heart rhythm in an effort to get 4 drugs anymore. Add to that the fact that any time we defibrillate, there's a small chance your heart won't start back up. Defibrillation isn't like a jump start. It's like getting hit by lightning. We really are interrupting the electrical conduction in your heart, so that it resets itself. Dude was playing Russian roulette with his life, and any of those times it could have killed him, just for a single dose of 4 versed. Story 26. My grandpa. The hospital released my grandpa because he said he wished to die at home. Both the hospital and his doctor said they can't do anything for him anymore and gave him only 2 to 3 days. He had a blood poisoning from long-term dehydration, urosepsis. He wasn't able to eat or drink or walk or speak or read or basically do anything. Breathing and urinating into his catheter, that's all. Since he's already 93 years old, has cancer, diabetes, is blind on one eye, and some more health conditions, we already prepared everything for him to leave this planet. Fast forward 5 weeks later, and today he walked for the first time again. Not only is it a miracle how he's been surviving his lethal cancer for 20 plus years, or his diabetes at age 93, or even becoming 93 years old, or how he survived a urosepsis with lethal bacteria, but the fact that he's making a full recovery from basically coma to eating, and even walking a few steps, is something none of his doctors is able to explain. Might not be the most badass story, but it's the one I can tell. Moved in with my grandparents shortly before he was released to help and assist with everything. We'll stay for 2 more weeks, and then they're probably ready to be fully self-sufficient again. Story 27. Not a doctor nor a nurse. The story is my father's. One day he wakes up and feel a little bit lightheaded. Headache, struggle to walk, and he overall doesn't feel well. He goes to the drugstore to check on his blood pressure, and it was at 250 or 260, I can't remember. When the pharmacist checked his result, he just said that he doesn't know how he could be conscious and called an ambulance. The second story is also my dad's one. He wakes up one day, and he had completely lost his sense of balance. He tried to get out of bed, but just fell down. He decided to go back to sleep. The day goes on, and I take care of him, feeding him, and everything else as he listens to the TV. The next day he still can't get up, and can't even sit down. He starts being confused. He really hates going to the hospital, so when I called the ambulance, he just sent them back and went to sleep. The third day he's confused as hell, doesn't recognize me, doesn't know where he is. I once again call the ambulance, and at the moment the staff enter his room, he's back to normal, acts like nothing happened, and send them back. As soon as they left, he was back to being completely lost. On the 4th day, I managed to convince the ambulance to take him, even though he refuses, and during the ride he falls into a coma. He arrives at the hospital, and the doctor finds a blood clot in the region of the brain controlling balance. It was stuck there for 4 complete days, and his brain now had swollen enough to put him in a coma. That part of the brain completely died, and he couldn't walk ever again. Well, that tank of a man woke up 3 days later, tried to get up but fell. However, as he hates hospitals, he uses all of his energy during the time he's at the hospital to relearn how to walk by himself, and, after a month, he just fled the hospital. From that point, he never walked perfectly, but at least enough to be functional. He died this year, but damn it was he a tanky human being. Story 28. Back in the 90s, A classmate of mine hit a chain across a snowmobile trail at 60 miles per hour at night. The snowmobile had a backrest. He shattered his ribs, badly bruised his heart, lacerated his liver, lacerated his spleen, and squished up some other parts as well. Punctured his lungs, etc. He walked home and went to bed. His mom was a nurse, so she dragged him to the hospital. He had to be life-flighted to Duluth. The doc said he only lived because he was so muscular. It took him about 8 months to recover enough to be out and about. He must have lost over 100 pounds of muscle. He looked like death. He had to have open-heart surgery 3 times. Then he got a staph infection and went into septic shock. His chest looked like a horror movie with all the surgical scars. I ran into him a couple years ago. He's doing well. It's just so surprising that he was able to fully recover eventually. He looked like bag of bones the first time he was able to leave the hospital. He was "How are you alive?" gaunt.